Hi, we're MedPad, and MedPad is a modular symptom tracker allowing physicians to customize templates for patients to track their most relevant symptoms. Now, the problem is that there are over 7,000 rare diseases, each with its own complex array of symptoms that are often non-overlapping and very acute. Yet, physicians have no individually tailored way of tracking patients in between visits. And there are a number of health trackers, but they are often overgeneralized. So, we decided to create a platform that allows providers to monitor and triage care in real time that can be customized to a specific rare disease, and the physician is responsible for that. And patients can focus on symptoms that are most important for the health. And then this can also auto-populate a physician note, which reduces the administrative burden for physicians. Now, there are many of these health trackers. These are some of the biggest, yet they're often overgeneralized or too specific. And so MedPad puts the power of customizing data tracking into the hands of providers.
So we just wanted to demo what we have actually made. So let's pretend that I am Dr. Kim, who is one of our physician mentors that we talk to. So this is our web application. So I have already logged in here. So this is my list of all the diseases that I have templates for that I currently am seeing patients for. And let's focus on the last one, carcinoid. So I actually want to add a new symptom based on some new papers. So I'm going to go ahead and add flushing and add that. And then you see that that symptom now shows up in our list for carcinoid. We also have different codes, so you can send these codes to your patients, which is how your patients get access to your different templates. We also have this functionality on mobile, so let's switch to our mobile view. Again, I'm Dr. Kim, I'm logging in on my phone. This is the same list of symptoms and of diseases, so I wanna look at carcinoid one more time. So one new paper came in, and now I wanna add one more symptom. So I want to look at diarrhea, and I want to look specifically at the date and time of somebody's diarrhea incidence. And this is a date time type, so I will go ahead and save that. And so there's no real description because it'll just populate the date and time, so I'm fine with that, so I've saved that. And the other thing I'm interested in is going to be the quality of the diarrhea. So I look here, this is going to be one type, so I pick single choice. All of these different options are available. I want my patients to be able to select all these different types, so I go ahead and save that, and then I go back to my actual carcinoid syndrome symptoms, and you can see a diarrhea has now been added. So I want to also see different notifications. So one thing that's very helpful about data tracking is that we can actually triage for patients. So you can see that for carcinoid, if there's a certain amount of weight loss in a certain amount of time, that's concerning. And different alerts will pop up on my phone based on this type of data and this communication between me and my patient. And so let's look at the patient view. So let's say that I am Joe. And I'm logging in, so you can see all of my different conditions, and then if I want to add a different carcinoid symptom, you can see every different type of symptom, and I can go ahead and add that, and my app will remind me of different appointments and medications. Thanks, that's your demo.
Yeah, question. Is it a standard kind of a scale that comes up? Is it a 1 to 10 scale? Is it I think you had an infrequent or often. How do you determine the scale?
So I think that would largely be determined by the physician. So certain things would be a 1 to 10 scale, such as your pain, because that's fairly general to have a 1 to 10 scale, but other things like weight loss, that would be a different unit of measure. So it really depends on what you're trying to track, but you'd have the ability to select the scale based on the thing that you are really most concerned about.
So if you look over here with demo 3, you can add different types of symptoms.
Yeah.
Okay.
So who buys the product?
Yeah, that's a good question. So you're really going to have like 3 different groups you're concerned about. Apps that actually cost money are not likely to be actually used by people who have to buy them. So we don't want to pass any cost to patients. So we would not sell it to patients, but oftentimes clinical trials do need to have apps to track their patients who are enrolled. So you could actually sell them on an enterprise level to individuals who are looking to run clinical trials. And then also, once you gather enough database data with patients' consent, then you can actually create a database and then sell it to institutions, pharmaceutical companies, anybody who's looking to run trials based on patient data.
Question regarding integration with electronic health records.
Mm-hmm.
So that whatever you're gathering can seamlessly flow into your outpatient notes, etc. So what all electronic health records can your MedPad interface with?
as it stands after 48 hours. None of them, but
Yeah, we can make a PDF report that you can add as an attachment to a note, but that we'd work on that for the future.
And the unique thing about this is that it has fields. What we're doing is it's all put in specific fields, so this can auto-populate a physician note, reducing the amount of time that physicians spend not with their patient, spend doing administrative tasks, and enable them to spend more time with patients, and increases their revenue.